Hey guys, welcome back to our channel. If you're new here, don't forget to hit the subscription button. And if you're regular, welcome back fam. Today, we are diving into something real, personal, and important, and that's PCOS, or Polycystic Ovarian Syndrome. Whether you have been diagnosed, think you might have it, or you just want to understand what your friend or partner is going through, this video is for you. Yeah, PCOS stands for Polycystic Ovarian Syndrome. It's a hormonal disorder, yeah, that affects women of reproductive age, and it's more common than you actually think. But here's the thing, PCOS looks different for everyone. Some women gain weight, others struggle with acne, hair loss, fertility issues, irregular periods, name it. Let's dive into the causes. Like I've already mentioned, when you hear PCOS, think hormonal imbalance. Yes, we also have some other causes like insulin resistance, we have hyperandrogenism, but especially high levels of androgens. And what are androgens? These are male hormones, yeah? These male hormones, they mess with ovulation and insulin resistance. And yes, insulin. I know some of you are surprised. So PCOS is not just a reproductive issue. It affects metabolism too, which is why many women with PCOS struggle with weight, cravings, energy levels, yeah? So this is the pathophysiology. It could be a little complex, but if you need a takeaway from all this, you just need to know that we have hormonal imbalance, whereby we have increased ratio of the female hormone and decrease in the follicle secreting hormone. And then we also have increased testosterone. Those are the causing the hyperandrogenism. And then we have increased insulin levels, but also we have low glucose tolerance. Yeah, so we have an issue with insulin, we have an issue with male hormones, but we also have an imbalance in the female hormones, right? Let's dive into symptoms. Yeah, and remember, not every woman has all these symptoms, right? So we have irregular periods or no periods at all, what we call amenorrhea. And then we have weight gain. One gains weight, and this weight is usually especially around the belly, yeah. And then we have acne or oily skin. If you look at the picture above, is for Keke Palmer. Recently was kind to let us know that he's been struggling with PCOS. But you see, the kind of acne she had is that typical acne for PCOS, whereby it's around the cheeks and then below the chin. That's the area in which you have an intense breakout, right? So we also talk about the excess facial or body hair, which is also called hirsutism. The lady above there in blue, you can see she has some more like a beard. I know we have a belief around here in Uganda, we have a belief whereby people think when someone has hair, it's going to have a lot of money. I think now we are also debunking that myth, right? Those are increased levels of testosterone, yeah. So we also look at hair thinning or hair loss. Some people get alopecia as well. So you see, someone with more like has a bald head in the middle, and that's a lady right there. We have mood swings, anxiety, depression, yeah, trouble getting pregnant, fatigue, yeah, low sex drive. Okay, so and many others, to mention but a few, right? Now that we know our symptoms, it's important we understand how do we get diagnosed, yeah? And I advise that you talk to your doctor. Please don't do self-diagnosis. So don't self-diagnose. So diagnosis usually involves a combo. It's a combo of usually three. It's the blood tests, and in these blood tests they do check your hormone levels, the testosterone, the estrogen, the progesterone, like all those female hormones, right? And then the male hormones as well, the testosterone. So we also have an ultrasound, and this ultrasound is to see the cysts in the ovary. So I think you see a picture right there where we have a normal ovary and then an abnormal or a polycystic ovary. Yeah, it has a lot of cysts from the picture there. And then the third to the combo is medical history and symptoms. Those are very key in your diagnosis for PCOS. Now we need to talk about management and treatment, right? And here's the truth. There is no cure for PCOS yet, but it can be managed. The treatment depends on your symptoms and your goals, yeah? And there are some options, right? So we have lifestyle changes, and it's really, PCOS is big on lifestyle changes, diet and exercise. I think we've had a couple of reviews lately on the keto diet that is helping a lot of women with PCOS. Anyone, if you're struggling, please try the keto diet. It may work for you. But also exercises, yoga is key. Like there's some I've gotten you some different poses you can do for your yoga. If you have PCOS, you have the bridge pose, boat pose, child pose, breathing exercise, cobra pose, sun salutation, right? And then we have birth control pills to regulate the cycles. Like we've mentioned already, we have issues with hormones. We talked about insulin resistance. In that case, we need metformin to manage the insulin levels, right? And in case someone desires to conceive, there are fertility treatments that could help you if you have PCOS. But also supplements. We have supplements the likes of inositol, and then we have zinc, we have vitamin D. These are also very good supplements in case you're suffering from PCOS. So if you're dealing with PCOS, you're not alone. That's one thing you need to know. It's not your fault, and your body isn't broken. Take one day at a time, learn about your body, be gentle to yourself, and remember, being healthy doesn't look the same for everyone. Yeah. So if this video has helped you or someone you love, please give it a thumbs up. Drop a comment below sharing your story or tips, and don't forget to subscribe. Let's keep this conversation going. More women need to know they are not alone. Thank you for watching. I'll see you in my next video. Bye.